All attendees are in listen-only mode.
Hello, thank you for joining us today. Today we're going to be talking about communicable illness, and we're going to be talking about the regular flu season, but we're also going to talk a little bit more about what happens when we combine regular flu season with any natural or man-made disasters that may be going on in the illnesses that walk along with those types of events. This is part of the Firestorm 2017 Crisis Coach webinar series. We do appreciate your participation and listening in. And if you have any questions or would like to engage with us, please feel free to do so via our social media accounts. You can find us on LinkedIn. That's not listed here because it's a little more challenging to put the URL in. But you can reach out to us via Firestorm Sol at Twitter or on Facebook at Firestorm Solutions. And there is a hashtag for this and all questions that you may have. If you'd like to ask us a question on social media and you put the hashtag Crisis Coach, I will see it and I will respond or escalate it to someone who can respond and answer any questions or comments that you may have. So, I want you to know that Firestorm transforms crisis into value for your schools. Firestorm empowers you to manage crisis and risk, and our expertise is in crisis management, critical decision support, crisis communications, crisis public relations, and consequence management. We are your crisis coach for crisis and risk, and we follow a predict, plan, perform methodology. Our attorneys want to make sure that we tell you that this presentation is not complete without accompanying oral comments and discussion. Any work product provided by Firestorm must be read in conjunction with all guidance given by national, regional, and local authorities, as well as your company's personal counsel. Also, the information given and comments made in this webinar should not be interpreted as legal advice or legal opinion. I would like to thank our wonderful moderators, where I don't believe they're able to be with us today, but Dr. Rich Martin and Jill Royka have been wonderful supporters of Firestorm, and we in turn love the folks at the Tennessee Association of Independent Schools. Because you are a member of the Tennessee Association of Independent Schools, we're able to do some things for you that are underwritten by the association, and we'll talk about those a little bit later on in this session. But regardless to say, if you need anything, please don't hesitate to reach out to us and make sure to let us know that you are with the Tennessee Association of Independent Schools. You can visit the association's website to learn more, to get resources as you need, and you can visit our website at firestorm.com and watch past webinars either on our website or on our YouTube channel, download blogs and infographics and papers and briefs, and register for any future sessions or events that we have upcoming. I do want to let you know that on December 7th, we are going to be having a virtual stress test event called Lone Wolf or Terrorism. Does it really matter? I encourage you to grab a seat early for that, as those virtual stress test events fill up quite early. I am Karen Masula. I am the Chief Intelligence Officer for Firestorm, and I am pleased to have as our guest today Ken Mercer. Ken is a principal with Firestorm, and he brings a very specific expertise to this session on communicable illness. So I'm going to let Ken introduce himself because he does such a good job of doing so.
Thank you very much, Karen, and thank you for all of the independent schools in Tennessee for joining us today. I'm delighted to talk to you today. I'm a graduate of the West Virginia University, and I have a degree in pharmacy. I'm a licensed pharmacist in 3 states, but practice in Maryland. I live in the Baltimore, Maryland area. I have 3 kids and 2 grandkids. fact, one of my children is my Firestorm business partner, so some of you may have interacted with Ryan Mercer over the phone in the past few years. I have recently been appointed to the Academic Advisory Committee of the Emergency Management Program at the Frederick Community College. They offer a 2-year associate's degree in emergency management, and they have both traditional on-campus programs and online programs. So if there's anyone in your school system who might be interested in an emergency management course of further study, I'd encourage you to check them out. Feel free to contact me for more information. My email address is on the screen as you see it. Thank you.
Thank you, Ken, and congratulations on that honor. I love to see more people entering or learning about the field of emergency management. And I think we can all see as the world evolves around us that we really do need to be our own first responders and have as much knowledge as possible so that we can protect ourselves, our families, our children, our schools, our teachers, and others within our environment. So on that note, last year we asked you in a survey question, have you personally read your school organization's Communicable Illness Plan? And the number was up from the year prior, which was good. We saw that about 62% said yes. And so that's a good thing. However, that means that about 40% of you folks have not only never seen a communicable illness plan, but do not know what one is. So we want to talk about that a little bit and help you in your efforts to move that forward, because we believe that that communicable illness plan can really be a great foundation for the entire continuity plan for your school and your campus, no matter how small or large your educational organization is. So the first thing we wanted to talk about when we were planning this webinar, we said, okay, we know this is flu season, and every year communicable illness is certainly something that we need to understand and plan for. But what happens when we have a combination of communicable illness and a significant weather event or natural disaster? A few years back, we saw that with Sandy, because Sandy hit in the frigid weather months. So there was a terrible situation of flooding and ice and all kinds of challenges with no power that created a cascading effect of other illnesses. So Ken, I wonder if you'll just kick us off today on this session by talking a little bit about what we're seeing on this screen and what this all means.
Thank you, Karen. The graph on the right, the bottom axis, indicates the kinds of communicable illness that you might see post natural disaster. You have how those various diseases are transmitted: waterborne, airborne, vector-borne are varmints, mosquitoes, rodents. Across the left-hand axis, we see the risk factors. So these are the things that, the conditions that you are seeing during or following a natural disaster. You have populations that are displaced and confined to small areas. They're overcrowded. You have stagnant water in your environment. You have poor sanitation, contaminated water supplies in your environment. All of these things lead to illnesses. It's really just about displaced people that are forced to live in tight, crowded spaces. They lack food, lack clean water, and lack general cleanliness. Minor illnesses and injuries become major illnesses and injuries without treatment. And the damaged healthcare system that you're associating with that right-hand photo is not capable of keeping up with the needs of this population. So, thank you, Karen.
Well, I think the other thing that we see, according to the National Institutes of Health, we know that flooding is one of the common major disasters that any regional area is going to experience. So whether you're in New York or Tennessee or California, we know that we're going to see flooding. I live in Charleston, South Carolina, and if someone cries here, it floods. And we had a 1,000-year flood event just this past year. And it was really significant. Not only did we have roads that had washed out and emergency personnel couldn't get where they needed to be, but when the rain stopped, overflowed their banks, and as the rivers overflowed their banks, they caused secondary flooding. And along with that flooding, there were a variety of risks and challenges. And so we wanted to talk about the impact of not only regular communicable illness, but how disasters can add to the stress of that. Mortality rates are found to increase up to 50% in the first year post-flood. After floods, there's an increased risk of disease outbreaks. We know that hepatitis, gastrointestinal diseases, particularly in areas with poor hygiene and displaced populations. And we know that after Harvey and Irma and Maria, states from Georgia, Tennessee, Alabama, everyone was receiving displaced populations or people who were evacuating. And those people were in shelters. Those shelters were in schools. And so we know that that confined space and the challenges brought on by that for security, sanitation, and nutrition really stressed not only the infrastructures of small towns and cities in the evacuation areas, but certainly school systems and schools themselves who were supporting those evacuation efforts. We also know that psychological distress in survivors is going to exacerbate their physical illness. So, you have a family that has lost their home. Their children are being displaced to another school, maybe in a completely different area or even state. They're staying with relatives. And psychologically, there is fatigue and stress involved, and that can exacerbate any illnesses. So we need to keep especially aware of those children with special needs, but also our teachers and staff within our organizations who either may be displaced after an event or who may be hosting families who were displaced. So we have a lot of social issues that we need to be aware of and pay attention to. Disasters and illness really increase the risk factors for mortality rates. And I'm not exactly sure where this image was taken, but when I first saw it, I actually thought it was my hometown. I thought it was Charleston, South Carolina, on one of our connectors, because that's exactly what it looked like during in our major flooding event. So we want to talk a little bit about, in addition to knowing that there are some general illnesses that we must be aware of, we're going to have an overtaxed, and on top of that, we have people who may be coming into contact with a variety of critters, and that's a real problem, especially when it comes to children. Our children are curious. If there are waters in your street or outside your school, we know kids are going to go out and want to stomp around in that water. I know even my husband wants to go out and stomp around in that water. And we had an alligator walking across our street during one of these events. We in South Carolina have had a significant increase in copperheads because of the rivers overflowing. We had a rodent issue that had to be aggressively taken care of. We had all kinds of different spiders from places we'd never seen before. And something that I thought was an interesting phenomena, we already have a pretty annoying mosquito population. It's our state bird. But suddenly, after Hurricane Matthew, we saw a completely different breed of mosquito. They were bigger, they were meaner, and we weren't sure what they might be carrying. And I know, Ken, you have some very specific points of view on this slide.
Thank you, Karen. Mosquitoes have been called the deadliest animal in the world because of the diseases they carry. Mosquitoes kill 1 million people in the world annually. About half of those deaths are due to malaria, and while malaria is not prevalent in the United States, they bring a host of other problems. And environments like the photo that you're seeing, water, contaminated water, and it's stagnant. And then in the right-hand photo, you see piles of trash. That is probably wet trash. Mosquitoes, rodents, and molds. Molds are particularly troubling for folks with respiratory problems. These are young children and the elderly are who we first think of as being subject to the respiratory problems. So these environments just are a breeding ground of these kinds of vectors, rodents, who are bringing disease to you, disease that didn't exist before this catastrophe happened. We've spent quite a bit of time, I guess 17 minutes so far, talking about all the bad things that happen. And I guess everybody probably knows all the bad things that can happen. But there is something you can do about it. And we're going to spend the end of the talk today talking about that your risk, the impact that you feel can be reduced. Thank you, Karen.
Oh, thank you. I appreciate that. Just 1 second. I need to do something. And can you hear me okay, Ken?
I can hear you fine, Karen. Thank you.
Hey, great. Thank you. And thank you for that, Ken. You know, when we look at some of these images, we just need to remember that there are things you can do to mitigate issues that can occur. And Ken, I think that's a really good point that you make. Kids are going to want to go outside and play at any time. And when you have piles of garbage and we don't know what's in there, and when you have mold, it just can really exacerbate issues. So we have to make it a part of our curriculum when we teach our kids, but also their families, of what to do in a crisis or a disaster. I'm going to go ahead and mention Firestorm founders wrote a book called Disaster Ready People for a Disaster Ready America. You can find that on our website at firestorm.com, and you can go under resources in the navigation at the top, and there is a link to Disaster Ready People. And you can download that ebook for free for your school or your organization. You can send it as a link to families within your community, because the better prepared people are in your community, the better and more resilient your school and your educational organization will be as well. And when we talk about some of these challenges, we know we saw some devastating wildfires across the country this year, but also we saw other airborne challenges in that, as you may recall, when Harvey came through Texas, people had to evacuate. They had to evacuate chemical and industrial facilities, and those chemical and industrial facilities caught fire, or there were explosions, and they released chemicals and other challenges into the air. So we need to be aware of what's going on in this regard as well, and how it can in fact impact you or neighboring states and those in your care. Young children we know, or elderly, anyone with heart or lung ailments are going to be vulnerable. And anyone with a lung or heart disease needs to make sure that they've got their medication, they have at least a 5-day supply on hand. And certainly those individuals and children with asthma and other respiratory ailments must be looked after with particular care under smoky or airborne pollutant conditions. And Rich Martin, you joined us, I see, and I'm very happy to have you with us today, so thank you. I just noticed, and I am sorry, otherwise I would have welcomed you earlier. I welcomed you a little bit, so now I'll welcome you more. Also remember, when smoke levels are high, don't use anything that burns within your homes. No candles, fireplaces, or gas stoves. Don't vacuum. I mean, I'm happy to not vacuum. That gives me a good excuse, certainly. I don't mean to make light of a serious situation, but if you vacuum or sweep during an airborne event, it's going to stir up particles already inside the home and can cause distress to you and others. And, you know, we had an event here, as I mentioned again, in South Carolina, and we are southern states, right? Tennessee's a southern state. We're humid. And when we're in environments where we get very warm and very humid and have a flooding event, people sometimes think, well, I can, you know, replace that bottom 2 feet in my home of drywall and I'll be okay, and the floors are okay because they seem to have dried out. But we know that nothing ever really dries out in a warm and humid environment. So you have to be especially careful for mold and mold growth in your schools and in your homes, and be aware of the impact. So we're going to just wrap up this portion of talking about natural disasters and illness and why health risks increase. And the things we really want to focus on are standing, stagnant, or contaminated water. Even the smallest wound, the smallest little scratch, can become a significant infection. And so we want to make sure that we have go bags prepared if need be. And in those go bags that we have good first aid kits. And Ken has mentioned a few things that he adds in his, things like bug spray, and just other things that are very practical, alcohol wash for your hands to keep us safe in times when we may have to evacuate or relocate. Poisonings and gastrointestinal infections are prevalent during a natural disaster event because of a variety of lack of power, which causes spoilage, eating things we're not familiar with, and infections from contaminated water as well. And so we want to be especially focused on insect-borne illness and training and awareness in that regard, cleaning open wounds, waterborne and communicable respiratory and gastrointestinal diseases, making sure we have good water sanitation, especially if your school is being used as a shelter facility. And then being especially aware of those persons or students or teachers with existing conditions that may need some level of extra care. And mostly we want to protect against exhaustion, especially in a natural disaster event where people are simply psychologically exhausted and emotionally drained. So we want to keep our eye on those types of risks. You know, I wanted to include this image as a learning lesson, the next couple of images, because so many of our schools are used as shelters, and we want to make sure that we're equipped to handle whatever challenges may come our way while keeping our own students and staff safe and being able to continue on with our goal of educating students. And this image is from 2005 from an evacuation in Hurricane Rita. And this was an elder care facility where they had to, they were trying to get these folks from the facility to a small airport. And so they used Army cots, these sort of Army, not cots, but stretchers, and loaded these folks onto a luggage cart and move them across the tarmac. And I can't imagine that was very comfortable. And the last time I saw a luggage cart, it didn't have very good shocks. So we know that since this was 2005, we've learned an awful lot since then, right? Well, perhaps not. This was, you probably recognize this photo in the top left. This occurred just recently during Hurricane Harvey. And this image was posted by the person who ran this elder care facility because she was trying to get help. So she posted it on Facebook. Her daughter then shared it, and she did indeed get the help that she needed. But this is the kind of situation that can happen in not only healthcare facilities, but all types of facilities in a moment's notice. And we never want to see something like this. We do have a program in place for healthcare facilities, and so if you're a school organization in Tennessee and there's a healthcare facility that you feel, whether it's a dialysis center, an elder care facility, a nursery school facility with healthcare, or a school facility inside of a healthcare facility, and you know they could use some help and guidance, there's something called the 2017 Emergency Preparedness Rule that actually, that says 8 days, but I think we're down to 5 days now, or 6 days, until the November 15th compliance date. And there are 17 types of healthcare organizations that must be in compliance. And we believe we're going to see this spread into other types of organizations, such as schools, in the coming years. So it's a good thing to read up on and be ready for. And basically, it's through the Centers for Medicare and Medicaid, and it says if you're not in compliance, if you don't have your own single generator, and I'm not talking about a mobile generator, but I'm talking about one of those big generators, $60,000 generators, you're going to be out of compliance and face some pretty significant fines, but more importantly, you will lose your Medicare and Medicaid money. So important to understand and think about how it could reverberate into the educational environment. Okay, Ken, why don't you talk to us a little bit about planning for communicable illness in your school or your organization and how we really kick that off?
Sure. Thank you, Karen. There are a lot of different things to think about. We're going to see a slide in a couple of slides that will show you a table of contents of a good communicable illness plan. There's just a lot of things to think about. And what we've done is help you do that. So we've got, I think the next slide is a screening tool that we can use. Things to think about are monitoring. How do you know when an influenza pandemic or other illness, tragedy is heading your way? Think about leave and absenteeism policies. Human Resources typically does those things, but it's a good time to look and see what you have in place. We do have a high-level assessment tool that we'll be happy to provide for you to help you evaluate what you've got in place. Again, these are because we've done the work. We know how long it takes to develop these kinds of policies and procedures. Develop them, practice them, train them, and test them. Thank you, Karen.
And you know, the practical advice is, and this is advice y'all have been spreading around your schools for a long time, and this is the challenging part, isn't it? You have students who are ill. They may be coming down with the flu or some other communicable illness. We're seeing a mumps outbreak walking across the country right now. But mom and dad or the caretakers or custodians of those children have to go to work. And so they think, oh, well, it's a sniffle. But you know what? You go to school today, John, and, you know, if you feel bad, go see the school nurse. I mean, we know that's how it happens. And then the children are sick, and they bring that back home to their parents, and their parents become ill. Well, if one day you walk into your school and you have 70% student absenteeism and you've got 70% of your staff is not able to come in as well, are you able to provide alternate ways to educate? Do you have those plans in place? Are there critical people, you perhaps, in your organization? What happens when you're ill for 4 days and unable to come in? Who is trained to cover you in that absence? And so we need to make sure that people understand if you're sick, just stay home. Figure out what the alternate is. Again, if we give everybody that book, Disaster Ready People, and we can get people to start planning for their personal first response and how to take care of themselves and their families, they'll be better prepared. We want to teach people, cover your nose and mouth with a tissue when you cough or sneeze. It seems so simple, doesn't it? And we want to use our sleeve, not our mouth. And that is, you know, we have many kids who stay with grandma and grandpa, and that's not exactly what grandma and grandpa learned. So we need to re-educate our communities as well. Wash your hands often with soap and water or use an alcohol-based rub. The best thing you can do is just leave those all over the place at your school. And today, I don't know if you've ever had someone hand you their iPhone or their smartphone or a mobile device, or you've gone to sit down on a computer in the computer lab or one of the laptops in the computer lab and just thought to yourself, oh, I cannot touch this. So we want to make sure that we have more than enough lens wipes and alcohol wipes and device wipes available so that we can keep the devices clean as well. All of these shared devices can become main culprits in spreading disease. A few years back, I ran a career center for displaced from a specific organization, and they were coming in every day and looking for jobs. And one person who was a job seeker had no choice but to bring her children, and we encouraged that because we wanted them to be able to use the facilities and feel comfortable. What we didn't know was that one of her children was developing pink eye, and they played on the computer on one of the laptops, and the next thing we knew, we had about 33 people who had pink eye in the organization. So we want to avoid touching devices or our eyes, nose, or mouth without having proper cleaning procedures in place. And of course, clean and disinfect frequently as possible. And try to do the easiest way to prevent the spread of disease, and that's by washing our hands. Now, we have some other factors that we want to look at. Wipe down surfaces, keep your hands out of your mouth, nose, ears. Remember, if you have displaced populations, people that may have been evacuated from Puerto Rico or from Texas in your state in Tennessee, that those displaced populations bring different things with them. So we really need to think about that and think about how we can help maintain a healthy atmosphere. We also want to encourage our students, parents, teachers to do all of those things that we know make us healthier people. Plenty of sleep. Go ahead and give out masks if we need to during a specific outbreak. Exercise, healthy eating, and then certainly be diligent on your property, on your school property, and destroy the habitats. of those critters that can impact our health. Ken, you want to talk a little bit about this, and I'll also move forward into the next slide, and we can start looking at what a communicable illness plan should look like for a school system.
Yes, Karen, thank you. This is just kind of one little step in our program, and it illustrates the way you can go about preparing for these things that might seem insurmountable. They are not. This just represents a way to look at what you need and when you need it to continue to run your school. How many folks do you need on site following a disaster when you might be closed, you reopen? How many people do you need on day 1? How many do you need on day 7? What do those people need when they come to work? Do you need a printer, a copier? If you are displaced, if you know this in advance, by day 3 you'd like to have a copier in order to keep operations, your plan will include a way to get that. That's just not something that you can have access to in the crisis. So when you are evacuated and at a different location, if you've thought about what you need and how you'll get it in advance, your chances of success are far, far better. Thank you, Karen.
Well, it's a great point. I mean, it's a really great point. We want you to be successful. We want you to have a good communicable illness plan in place in your school. And it doesn't have to be a 300-page elaborate, 17 binders on the shelf, because quite frankly, nobody's going to go read those binders on that shelf, right? There are a lot of plans out there, and there are a lot of things in place that tell you what to do in the event of some sort of communicable illness epidemic or pandemic, but they don't tell you how to do it. So what we want to focus on is the how to do it. We're going to give you a couple of resources before we leave today that will help you move forward with your teams on how you go about doing it. And what we want to do is address as many concerns as possible that your school organization is going to face during an illness outbreak. I mean, we saw a lot of that over the past couple of years, right? We had Ebola, and we had some other things that people were very concerned about. So we want to first conduct a gap analysis of your existing plan. So you're going to sit down, you're going to do that, and you're going to say, okay, what are we missing here? What documents are we missing? What policies and procedures are we missing? And we want to go ahead and get a checklist of that going. Then we want to identify what triggers your plan. What is the activation trigger? Who triggers it? And who communicates that? Do we have that clear? If that person's not available, is there someone else who will take over in their stead? And that's one of the things in school systems, especially because we change, right? We have rotating or transient bodies of students and families in our community that move through. So we really need to be aware of who's the backup to the backup and make sure that we keep that updated, and the digital world has made that very easy for us to do. We then want to make sure that we understand our monitoring plans. How are we going to monitor outbreaks or the spread of disease or what's going on in our communities, and how we go about in developing and conducting the training and testing procedures to meet those needs. And then think about supply solutions as well to support any mitigation procedures that you might have. We don't want you to have a warehouse full of supplies that you may need during an illness, especially if those are going to expire. But we do need to make sure that you have on hand the supplies that you need should there be some sort of an outbreak or an illness that occurs. How are you going to take care of your students, and how are you going to take care of your staff and others in your organizations, visitors? What if an outbreak occurs during sporting events or other types of community and school events? So this is a little high-level overview of what a communicable illness plan might look like. Now, this is a very long plan. It's a 100-page plan, and I just gave you a couple of screenshots of it. Yours may be 7 pages. If you have nothing right now, 7 pages is better than nothing, right? And it is the planning, the getting your teams together, the testing to make sure that people really do know what they need to do should an event occur, where that is where the value is. Now, we want to help you and give you something, and this is a terrific paper that I don't know if everybody knows about, so I thought, well, I really want to share this today. This is a paper we wrote actually about a year ago. We gathered experts from our expert council and others from within our organization, and we wrote a very comprehensive paper, Planning for Communicable Insect-Borne and Epidemic and Pandemic Conditions. And you can get this from our website at firestorm.com/illness. You can download it for your school and share it with your teachers. And if you'd like me to send, you know, a few PDFs or something like that to you personally, I can do that for sure. And in this document, it really starts with some very basic parts of what a communicable illness plan should cover, and then walks you through some of the critical questions that we need to ask from a practical and a legal point of view. Susie Laughlin is a contributor on this. You may know Susie is an attorney. We have other attorneys, insurance professionals, and medical and healthcare experts in the paper as well. And we talk a little bit about attendance and leave policies, what you have in place. What if for some reason something happens and you need to do some level of termination or reduction in force? How about, when do you know to send workers home? What are you allowed to do? How about requiring them to stay? If you have children in your facility and they for some reason cannot go home, how long can you require people to stay? I don't know if you remember a situation in Atlanta, Georgia. While this wasn't illness related, it was weather related. They had that huge freeze and storm. And there were people trapped in schools overnight with children. There was a special needs school bus that was stranded on the side of the road, and thank goodness those children weren't abandoned by the people who were caring for them. But you really have to walk through those scenarios, because as soon as you think something can't happen, it can. How about if someone refuses to come to work? How about if I say, I'm not getting sick this year, everybody's sick at school, I'm not coming in? Do I have a right to do that? And what are the pay policies in that regard? What about special work restrictions for persons who may be ill or becoming ill? Do we have any special restrictions in place? Is there any way we can do telework or teleeducation? Do we have that set up? Is that in place? Do we even have maybe a GoToWebinar subscription so that if we need to do 8 hours of webinars a day and teach children via webinars, we can do that? What kind of social distancing policies do we have? How about visitors to our property? And those visitors include vendors, suppliers, guest speakers, and others from our community. What do our benefit plans cover? How about our employee assistance programs and our student assistance programs? What are those visitor policies, and is everything documented for our employees? So in our schools, we want to do, I think, the simplest thing we can, and that is follow the Firestorm base methodology of predict, plan, perform. Predict your vulnerabilities, plan your responses, and then perform at the highest level when the event occurs. And I think that paper will help you. And again, our book, Disaster Ready People, will help as well. We want to thank, as always, the wonderful folks at the Tennessee Association of Independent Schools. Again, visit the website. You can have access to other resources, and if you need anything at all, because of the Tennessee Association of Independent Schools, we are happy to provide you a no-fee assessment that is underwritten by the good folks there. So if you would like to reach out to us, We can arrange for a very simple, about 1 hour conversation with you that assesses your current plan and helps you move forward into any other areas to make that more robust. And again, that is because of the good folks at the Tennessee Association. Ken, would you like to have any closing remarks for us today about how we can stay healthier and safer in our schools and with our students?
Thank you, Karen, and thanks to the Tennessee Association of Independent Schools for sponsoring today's webinar. I've enjoyed spending some time with you. Preparation is the key to success. There are things that you can do in advance to prepare for these kinds of things. It's just the taking the time and having the skills to do that. We are here to help. Thank you.
Thank you, Ken. Thank you, Rich. Thank you, Bill Baker in the background. If you need anything, please call us at 1-800-321-2219. And you can visit us or email us at webinars@firestorm.com. Stay healthy, have a great day, and this will conclude today's session. Thank you and goodbye.